In an upcoming article that I'll be publishing in the Sleep Review magazine, I talk a lot about how physicians often work in a model where they try to adhere to various standards and guidelines, otherwise known as practice parameters, in making decisions about clinical care for patients. And one that I've been concerned about for a long time is there is a guideline, not a standard, but a guideline overemphasizing the idea that you don't use polysomnography in the evaluation of insomnia on a routine basis. I disagree with that. I think that it should be used on a routine basis. But the interesting concept here is that that guideline is developed in part because there's a lack of evidence to the contrary, but also because a group of people get together and have a consensus statement developed, and that's how you end up with that guideline. Well, in the Journal of the American Medical Association this week, the February 25th issue, there are two very interesting articles about this concept about how guidelines are developed. And the articles are actually quite disturbing when you think about the fact that cardiology, which is what one of the articles is on, cardiology is a field where we are spending hundreds of millions of dollars in research. And yet, when it comes to developing these guidelines, this study looked at about a 20-year trend and noted that there was not an increase in evidence, of research evidence, that was allowing the guidelines to have more support. A guideline becomes more of a standard once there is much more evidence. Instead, there was lots and lots of this consensus formation, this expert opinion, where you put the best minds together and you hope you come up with the best clinical advice, but it's not necessarily based on evidence. Research evidence meaning from, well done, well designed scientific studies. And there's another editorial in the JAMA issue, again February 25th, that gives some very biting commentary about how this form of analysis really approaches almost a groupthink mentality, because there are just a number of guidelines put forth that could be influenced by financial interests, other biases, other conflicts of interest. And it's a very important thing to understand that if you really want to get the best scientific advice, you'd like to be able to steer it almost exclusively, if it were possible, just on the evidence. And if not, one of these editorials says then it's very important to rely on the judgment of your physician and not necessarily some guideline that has been put together by a group of experts. Obviously that's true sometimes, obviously it's not. But it's interesting to see this is a very hot topic in the field of medicine in general. And that's one that I think is going to come up in the field of sleep medicine over the coming years.